Hello, my name is Woo-Jin Jung, and I am currently a master's student here at CUNY School of Public Health. My capstone project this year is titled The Correlations Between Systematic Problems, Age, and Gender to the Severity of Periodontal Disease. My advisor, Mustafa Hussein. This presentation contains an overview, introduction, background, project methods, results, findings, discussion, and conclusion as stated in the table of contents. The overview of the capstone, the objective of the project was to explore correlations between the severity of periodontal disease and factors such as age, gender, and systematic health problems, utilizing a patient scoring system and statistical methods to analyze the relationships and contribute to the understanding of periodontal disease progression. The method includes the introduction of a patient scoring system in periodontal research that plays a crucial role in simplifying the complex array of variables linked to the disease, providing a unified metric that facilitates the assessment of periodontal severity for practitioners and researchers. The system, coupled with a statistical methods like an ANOVA and t-tests, reveal a nuanced insight into variations among patient groups, allowing for a thorough investigation into factors influencing periodontal disease progression and contributing to the formulation of targeted and effective interventions. The results consist of this study that presented a limited significant finding attributed to a presumed influence of a small sample size, as illustrated by the comparison between males and females in the control group experiencing periodontal disease without additional systematic problems. Lastly, the conclusion. The study underscores the intricate nature of systematic problems and periodontal disease relationship, urging further exploration in oral health research. In terms of the project methods, data sources were received from Dr. Huang at Huang Dental, located in Flushing, Queens, including pocket deaths of individuals with periodontal disease and systematic problems, recorded age, gender, systematic problems, probing deaths, and bleeding for each patient across 6 sections of the tooth. The patient scoring system was developed in a novel scoring system considering probing pocket depth and bleeding to assess periodontal disease severity comprehensively. It excluded factors like third molars in order to eliminate potential bias and adjusted final patient score for bleeding in high pocket depth areas. Lastly, the multiplication of probing pocket depths by corresponding occurrences and subject adjacent provided a nuanced measure of disease severity. In terms of statistical analysis, I utilize t-tests and ANOVA to analyze the descriptors and correlations between systematic problems and pocket deaths, as well as formulated null and alternative hypotheses for each analysis with significant level of 0.05. And I examined the association between periodontal disease and systematic problems, age and gender, considering potential co-founders like age-related factors. In terms of the results, in table one, the first 22 patients did not have any systematic problems other than periodontal disease, whereas 33 patients did have other systematic problems. And to find the overall impact of these systematic problems, the frequency of each interval of 100 was recorded. No interval below 300 was recorded because none of this study patient had a patient score below 300, as well as it is worth highlighting that a significant portion of patients had scores between 500 and 600, signifying that most individuals in the study exhibited moderate to moderately severe periodontal disease, as these scores were the most frequently observed in the data. In Figure 2, the first column in yellow represents the percent of patients within a group without systematic problems. The other column, black, represents the percent of patients within a group with systematic problems. And in Figure 2, both groups had a similar percentage of patients who fell within a range of 500 to 600 in terms of patient score. However, there were more patients without systematic problems that had a patient score less than 500, whereas there were more of a percentage of patients with systematic problems who had a patient score of more than 600. Overall, patients with systematic problems have a higher patient score. In Figure 3, it was calculated that males have an average patient score 100 higher than females. It's important to note that the p-value for the t-test was 0.11, meaning that the alternative hypothesis must be rejected. Also, the error bars overlap, meaning that the differences in gender are not statistically significant. The study is not inconclusive due to a difference between genders. Even though the difference was not statistically significant, past studies suggest that males have more periodontal disease, possibly because of lifestyle choices. Such lifestyle choices include women paying more attention to oral health and being more reluctant to visit the dentist more often. In terms of discussion, I obtained extensive data, including de-identified medical history, periodont maintenance charts, and specific dental measurements from patients within the disease, enabling a thorough analysis of the relationship with systematic problems, age, gender, probing depth, and bleeding. Then I organized the data into groups based on systematic problems, age, and gender, demonstrating a deliberate effort to control potential co-founder factors during the analysis. The detailed explanation of age patient scoring system calculation enhances transparency and facilitates replication by other researchers, promoting the reliability and reproducibility of the study. I acknowledge the limitations, including the potential for inaccurate data in medical histories, either accidental or intentional, and question the accuracy of patient scoring system, emphasizing the need for cautious interpretation of findings. In conclusion, the insights in terms of insights into the systematic impact on periodontal disease, explore the impact of these problems on the disease across diverse demographics, revealing noteworthy trends, including higher patient scores in individuals with systematic problems. And despite the caution in gender comparison due to non-significant p-values and overlapping error bars, the study offers valuable insight into the intricate relationships between the factors and the disease severity. In future directions, significantly contributes to periodontal disease, acknowledge thorough and comprehensive data set, the transparency and meticulous categorization of data by systematic problems, age, and gender, as well as acknowledging limitations, highlight the need for ongoing research to explore patient data accuracy and validity of the patient scoring system, emphasizing the intricate nature of the systematic problems and periodontal disease relationship for further exploration in oral health research. Thank you.